Hey everybody! Thanks for joining us here. We're uh, you know together again with the FlareVet people, the usual crew that you're used to,
He sounds so excited.
and then we have Greg Bishop, and then we're waiting on Sara Boston. I think she's lagging behind a little bit here in time, or she might be mad at Greg. I don't know. Something's going on, but um, we'll have her here eventually, or if not, I think we're pretty funny ourselves, and having Greg here is really like the best thing, for us in our group. So he'll lead on the conversation, and from here on, I'm just gonna have Greg take over the conversation because I think this is gonna be a whole hour about comedy in veterinary medicine and how we can use it as a tool with our clients. So anyway, I'm gonna let Greg. Um, Go on with it, and can you please stop eating and get on with this thing? What the
No,
hell?
sorry. Sorry, here, can you take this,
Give
please?
me that bowl. Give me that bowl, man. Okay. All right.
Okay, thank you for taking that. Um,
That was
Sure.
well
yeah,
executed. Yeah.
this is great. Technology is amazing these days, isn't it? And yet, technology is not funny. Has anybody tried? We talked about this maybe last time, trying to get AI to do jokes to make funny stuff. It's not very good. Um, but in thank you very much. In veterinary medicine, we have we're talking about comedy, we're talking about humor, and I've got this obsession with funny stuff, and we kind of talked about how we really need it. Like I think humor in veterinary medicine is important because it doesn't change the situation other than just mentally. Like there's a cognitive reappraisal that happens when you find the humor in a situation, and so you're not really changing the situation, but you're making it seem easier and seem more fun and seem happier. So I really love that, and I've tried to bring that to the profession in different ways. I mean, honestly, since vet school, we're always kind of looking for areas that we could have fun with, like goof off, but still, take the serious things seriously, but realize that there's a lot more to all of the interactions that we have. So yeah, I've kind of like been really obsessed with that. I'm putting on a workshop at the AVMA convention that's about like using humor as a clinical communication tool, and so yeah, it was kind of like I want to hear everybody's sort of take on either in the exam room, talking to, hey,
I'm sorry. I had technical difficulties, but I'm happy.
no
to
we
worries.
hear
it's
it.
well, that's how we were talking about that right before we started. How technology, like, even though it doesn't have a mind of its own, it like plays tricks with you. Like it's not gonna go well. It's not gonna go up. You're in. It's
Oh,
good. It's good. You're
yeah.
fine.
I have a system where I keep all my meeting invites, but I think we switched the linky link, and then I was like sitting there by myself, and I was like, something is wrong.
We're a very casual group, and you missed the opening passing of the bowl. I wish you guys would do that again.
Oh, I'm sorry I missed
It's
that, but I'm
okay.
happy to
Wait,
be here.
here, Greg. I'll give it back to him.
Yeah, can you hand it
Let's
back
do
to
it.
me, please?
Okay.
Yeah. I'll give it back to you.
Okay.
All right. You can keep eating, I
Thank
guess.
you.
Since Sarah's
Oh,
here, you're welcome.
magical.
Yeah.
This
Yeah.
is not the same.
Here, Sammy, take it.
Right.
No, we just got started.
Great.
Sarah, I was just
Yeah, we're good.
awkwardly stalling, but
Okay, sorry.
I
I'm
w-
so sorry.
can I?
Well,
No.
as you stalled, I actually had a question for you, and I think this is a really Greg Bishop thing. I think this, like, he excels at this stuff. And maybe Sarah can take it from there. Can you explain laughter as a seizure event? Like, because
Oh yeah.
we're talking to veterinarians and people in VetMed, so I kind of want to hear the explanation of laughter as a physiologic seizure event. What's
Wow.
that all about?
This is your brain. This is your brain laughing. So
Wow.
yeah, it's crazy. Like if you can make somebody laugh, you trigger this involuntary response, right? So it's an emotional reaction, but you actually like like if you get the humor, what's happening is these little centers in your brain start this response, right? It's involuntary, and you release dopamine and endorphins, and it literally propagates like a seizure throughout this whole circuit that's really similar to like the fear activation. So the whole like pathway starts in the same way, but if you sense the humor in it, you get this like seizure-like activity that makes you laugh. It controls the muscles that make you laugh, and it's just like this immediate reaction and relaxation that happens. So it's like so amazing to be able to do that, like to induce a seizure in somebody that relaxes them, that makes them feel good. And it's like it's pretty extraordinary, and that's why as a communication tool it's amazing, because you can go from like, you know, either this neutral state or some other state, and then suddenly, like, just with words or with tone or whatever, take somebody into this like really good feeling, like pleasurable experience. And it's just one of the magical things about it. I don't know, Sarah, like when you get a laugh, you can see people just relax and feel good, right? Like it's beautiful.
Yeah. And it depends what the context is. When I'm doing stand-up comedy, like if you don't get the laugh, it's the opposite of beautiful. It's not very fun. But yeah, like that's what you're going for, is to try to like, you're just literally just trying to make people feel good, make people laugh and connect. Like it is a way to connect with people. And then I would say in the exam room setting or at the work setting, it's a little bit different what you're trying to do. It's like a different way of connecting. Like I'm not like trying to make my clients laugh their head off, but I'm trying to find a tool to connect with them, or just to break some of the tension or the fact that they're so stressed or like so. And usually, I know we'll get into this, but that's often pointing to their dog or cat and something that's just silly or funny. Like it's not like a hilarious joke. It's just something that's kind of cute or funny that their dog's doing that can connect with them. So it depends on the client. I try to temper if I'm making a joke with them or not with sort of my rapport or what it feels like talking to them. So
yeah, I'm really curious about like because you're a trained comedian, like you went to comedy school and you have the theory and you have like the skills that you've built through training. Do you think of humor as a communication tool? Like, do you look at it like, hey, I could use this here, or I could see the thread that might help build this rapport?
Yeah, I think I always have. That's the funny thing. Like, because I've done a lot of lecturing, before I even started doing comedy. And actually, I mean, I think I've talked about this on my podcast, but so sorry if people have heard it before, but like as a resident, we had to do presentations, and I would always have jokes in my presentations. And it was a very long time ago, but one particular faculty would come down very hard on me and say, you can't do that. You can't make jokes in your lectures. Like it's not professional. And of course I did it anyway, because I was like, I really disagreed with that. Like even at that stage of career, I was like, no, first of all, it's funny, not going to let that go by. No. And then second of all, I just felt like, no, this is how I'm going to make people listen to me and connect with me. And I continue to do that. And like sometimes I would write the jokes before the content. Like I don't know if that's good or not, but I'd be like, I'm doing a lecture on osteosarcoma. Like, where's the funny? What's the jokes about that? And I would have jokes, like 4 or 5 jokes in there. And then I would like figure out what the content was I was going to do, or things would come to me as we went, or I'd tell a funny joke about the client, like just in the middle of talking about a case. Like I would just, something that was funny about the client. Like, I don't know, when I practiced in Gainesville.
Can I ask a question about that?
Oh yeah.
Did you have a sense of like the metacognitive, like the thoughtful aspect, like what made a joke funny, or were you just looking for the jokes because you enjoyed it? Or
yeah, I think at the time, no. Like looking back, I could say that, but no, I don't think I even really understood this is a teaching tool. This is a communication tool. I was just like, oh, this is a funny thing, and but I think I knew enough to know this will make people listen more. And then like when you look at the research on that, like it doesn't mean that your lectures have to be hilarious, but you need to create an emotional response in the audience. Like I'm sure everyone sat through lectures where it's just like osteosarcoma and this is a signalman, and then like you're not listening. Like, I'm sorry. Like, no one's really, students aren't listening. Veterinarians aren't listening. Like, how do you listen to that? Like, for an hour, you
I'd rather read
can't.
it.
Well, yeah, you can read it. It probably would be
Yeah.
more interesting to read it because you could stop and think about it. You know, and I think people are so distracted in lectures now. A lot of people are on their phones, and like, you've got to like break through and make them like, oh, so whether it's a story or whatever it is, it can be a sad story too that make people listen, that has a lesson to it. It doesn't have to be humor. I think for me, I gravitate towards just because I enjoy that more. But I think other lecture styles would be more storytelling. I think that's another important tool, as you know, as far as communication. A communication tool is like creating story. We're very wired for story. Like, you know, we're wired for jokes, but we are very wired for story as people. We make stories up. We make stories up about colleagues. You know, if someone does something, often it's negative. People make up a negative story about why they acted like that. And we have no idea why they did that, but we'll make up a story. Maybe that if we don't like that person or we don't like what they did, we'll make up a story that's a negative story about what they're all about. We have no idea. Right. So it's just something that we do. But yeah, I think it's just evolved for me because now I understand it better. You know, and it's always good to be proven right. Like,
Well,
see, I was right. Yeah. So.
We talked about this on our lead-in call, and I have a theory that like vets tend to think of ourselves as like effective communicators because the clients just self-select for people they think are funny. Like if I have a client who thinks I'm funny, like they'll come back, and if they don't, I don't see them again. So like my reinforcement learning is like,
that's
I'm
good.
great.
That's okay.
Right.
But
can you talk to the Sarah? Can you talk to the benefits of using humor in practice? Like, there's some proven things, right? Like you get more engagement, you get more compliance, maybe even like people get sold on what you're saying better, even if they don't know you as a medical professional, right? Like,
yeah, I mean, I think it also humanizes us a bit, and like you can see people like they come in and they're tense, and like if you can find a way, again, like you got to pick your audience a little bit, but if you can find a way to just make a joke about something, like even if it's stupid about the traffic or the whatever, like just to humanize you and that relationship. And you can kind of see people kind of, oh, okay. Like, you know, cause they're so, especially with what I do, cause it's cancer surgery. So my clients that show up are usually like, they're very worried about like, they're on the ceiling. And so, yeah, I think, I don't get repeat customers really.
That wasn't meant to be a joke.
That's like a Burger King. Yeah. McDonald's.
Yeah. I mean, I actually, that's not even true. That's a lie. I do. Sometimes I get like the next dog, and they're like, you treated my dog for cancer like 10 years ago, and they'll find me, which is really cool. I don't think it's a joke, but yeah. But I'm not like a primary care veterinarian who has like certain, you know, clients that like me for whatever, you know, and some people probably don't like me, and that's fine. You know,
everybody likes you.
No, I don't think so.
I've never met somebody that doesn't like you.
Yeah, everybody in this call, like, I
everybody was already a fan before we're like, oh man, can we get Dr. Boston? Like,
that's very sweet.
Seriously,
but I don't. I think doing comedy, I've had to have a little bit of a tough skin. I just did a Fringe, which is why this call was a bit delayed. I just did 8 shows at a Fringe, and I got really trolled by like one person, and it really upset me. But yeah, I mean, not everyone's gonna like your comedy, and not everyone's gonna like what you're doing. Not everyone's gonna like you as a veterinarian. Not everyone's gonna. People are gonna get second opinions. Like I'm just at the stage where I'm like, yeah, go do that. Like it doesn't bother me at all. Yeah.
I wanted to ask, you have the formal training. Can you talk about how you practice this? Like this is like you're naturally good at it, right? Like you had the inclination, but I imagine part of the formal training was like learning to practice.
Yeah. So there's different aspects. You do have to get up and do it. Like for stand-up comedy, there's no other way. Like, cause we did writing classes and we did stand-up classes and we did improv classes and acting classes. So yeah, pretty much all those things, you either have to like write it and get up and read it, or you have to like get up and do it. So like for stand-up particularly, we would have writing exercises, like, and then we would have to get up and do stuff. And then we were very lucky. We had a connection, like my school, which was Humber College, had a connection to Yuck Yucks, which I know you guys won't know these things, but Humber College is in Toronto, and then Yuck Yucks is kind of across Canada, but the biggest one is in Toronto, and it's kind of the comedy chain that's Canadian, the big one. And so we had a connection. Tuesday night was our Humber College student night, and it was like honestly awful. Like, it was awful. But we'd have like 5 to 8 minutes and, you know, get up and do whatever we're doing, whatever we're working on. So like, it was like a open mic, but it was protected. It was stage time. It was at a major comedy club. Like, I was so lucky that I got to do that because I became very comfortable at the Yuck Yucks in Toronto, which is like kind of crazy. Like, it was like, you know, I knew the bouncers and I knew the wait staff, and I'd be like, hey, you know, and then like, you know, there'd be like 20 people there, maybe the Tuesday nights. And I would tell people, I'd be like, don't come. But that's how you practice as a comedian. You do open mics or like little shows, and you get up and you have to, and I had to learn that because I get bored. So I'd be like, oh, this joke's boring, I don't want to do it again. You have to do that joke hundreds and hundreds and hundreds of times.
Really?
Yes. And you have to find it. And like, sometimes a joke that was killing, like another night, no one laughs, and you're like, or you're like, or you have to just accept it's just not funny, or you didn't sell it, or you didn't tell it right, or you have to just say, you know what, I think that's funny, I got to throw it away. So that's really hard. I do see, it's usually male comics, like they don't get the laugh. They're like, that was a good joke. I'm like,
Tough crowd.
Tough crowd. Like Weekend Update on SNL, like when they whiff on a joke, like they will tease the crowd about it. Like,
yeah,
even like that's like the pros of comedy, and like they strike out sometimes.
Yeah,
like they get groans and boos and silence sometimes.
Yeah, even them with all those writers, right? Amazing. Sure. But yeah, I think admitting it is the best you could do. Like, chastising the audience doesn't usually work. Like, if you say, oh, you guys, like, you know, it's probably better just either move on or just be like, okay, you don't like that joke, you know, and then they'll see that you're in the moment, you're human. Yeah. Again, I think like there's a lot of it just sounds crazy, but like being a human being, humanizing yourself, humbling yourself, you know, when it doesn't go well. And I think, yeah, whether it's on a stage or in an exam room or with your coworkers, like just kind of creating that safety is really, really important. I think that's what humor does for me anyway. That's we were talking before, like in the meeting or the organization call about like if you're in the exam room, like that's been my focus mainly is on like actual clinical communication, you know, talking to clients about it. And the question was like, okay, you tell a joke and it whiffs. And Bill, I'm not picking on you. You had some very funny jokes. I intentionally sent you like jokes that I still think are funny. Yeah. That landed like lead. I want to hear them. The exam room. They are funny. The audience obviously didn't perceive it. I thought like so, that's one of the things like about it is like, Sarah, what you're taking this very seriously in a way, like you're very you're a pro and you're going up on stage, you just put together this like huge show. When you're in an exam room and you have like you're telling a joke and it whiffs, like the great thing is you can just go right back into your like serious medical professional role, like put on that hat and be like, okay, so, you know, you just don't even have to acknowledge it, right? Like you don't have to sit there on stage and be like, no, my job is to make you laugh. No, my job is to help your pet. Yeah. And I'm just using this like as a, you know, seasoning for the experience. I think it's also so unexpected. Like, you know, thinking about lectures, like I always say that's just the easiest audience, like a veterinary oncology lecture, because they don't expect to be laughing. So like I make jokes that I'm like, this is not that good a joke, but it's almost, you know, a lot of joke is surprise. And so the surprise that a surgeon would get up and make a joke, that makes people laugh. Like, it's not even the joke. It's just the fact that I'm like, it's so like, oh, you know, why is she telling jokes, right? Maybe people know me now, so they kind of expect it. But like when I first started doing that, the laughter came from that. Like I remember when I was like very early in my career, I'd finished my residency and I was doing lectures that were like the abstract of my research. And there was something in there that I can't even remember exactly what it was. It didn't make sense. And I put up the chart and it didn't make sense. Like I couldn't really explain it. And I just said something like, oh, I know what you're all thinking. You're thinking this. And that made people laugh. It's not even that funny. It's just an acknowledgement of like, I'm in your head. I know that you're criticizing this. Like, I know exactly how you guys think. And I think that is really funny when you can do that, when you can be like, I know exactly how you're going to react to this. And I acknowledge it. And now like, let's have a laugh about it and like kind of move on. So it's interesting how much of this has to do with
connection and vulnerability, and I hadn't really thought of comedy this way, and it's interesting to hear you guys talk about it this way.
Oh, comedy is all about vulnerability. You should see
Yeah.
my friend show I just did. It was very vulnerable, which was why when I got trolled, it really hurt actually, because I was talking
Yeah.
about very like personal things that happened to me. My father passed away. I know that doesn't sound funny at all, but like the funny things that happened going through that process. So like, and then someone's like, I don't like it. You know, Mike Birbiglia is like my favorite comic. He has said, when you do stand-up comedy, like if you're like a pianist or you're a painter and someone says they don't like that art, like they don't like that art. But if you're a comedian and they don't like it, like they don't like you. That's what I'm like.
Right. Yeah.
Yeah,
It's
that's
very personal, right?
It's very, very personal. And I think comedy, like for me, like comedy is about the truth. And I have a colleague, actually, he's a physician who's a comedian, and he's become a friend. And we sort of had this disagreement because we were bouncing jokes around, and he's like, oh, say your boyfriend something something. I'm like, I've been with the same guy for 29 years. Like, I can't say I have a boyfriend. I never really had I have one boyfriend, you know, and then I had Steve. Like, I can't get on stage and talk about my boyfriend. And he's like, he goes, comedy is fiction. And I was like, no, comedy is truth. Like, and so that's a big difference. But I think the audience, they know if it's bullshit, and I don't know if I'm allowed to swear. Sorry.
Yeah, you're good.
No, I beat you to it.
No,
We're good. We're okay.
Bill did it the one time. He
All
was
the time.
obviously the first person, and then you're just following.
Yeah.
It's just part of it. No,
Just
that's
now,
great.
I'm not the most recent.
This is
So thank
safe
you.
space.
Yeah, I feel like we don't have enough. I feel like we don't have enough cursing.
Oh, you need more Canadians on. That's the problem.
Yeah, well, we have Chris.
Okay.
They're here on this side here.
But
he's there
he
for me.
won't,
Anyway,
he won't
I
say
also-
A anymore. He got bullied too much by Americans.
Oh,
I
I'm going
think
to do it.
Yes.
Also interesting. I think Sammy can talk to this too, but like, I'm a writer more than I'm anything else. And when you're a writer and you're out there and you're raw, if people don't like it, you can like, yeah, I don't really care. Like, it's not bad writing. Like, if you don't like what I'm saying, like, but if people don't like the comedy, like it feels different.
It's more personal, I think.
Yeah, you're like, oh, that's like, if you don't like my writing, like, I don't really care.
Yeah,
I do. That's why I write. Like, the comedy though, it's like you're waiting for that laugh is putting a lot more of like the value and the evaluation of it on somebody else's response.
Yeah, and
that's
it's in real
really,
time, right?
really a lot more vulnerable than
Yeah.
a lot of other forms of art.
You do have to have you have to develop. And I'll be really honest, like this weekend, I just had a misstep. Like, I just couldn't be tough. I don't know what it was. Someone put a really mean comment on my fringe, like it's so stupid. Like, again, it's a bit like academia. The fights are fierce because the stakes are so low. Like, it's like a fringe. Like, it's nothing. Like, it's nothing.
Right.
Was it about saying A?
It's like, it's not a big deal.
Did I do it? Did I say A? Yeah, it's gonna.
No, was it about that? Like the comment they wrote? Or
Oh no, it wasn't about that. No, because this was in Ottawa. It was a fringe. It was just like anyone could put a comment on your show, and someone just put like this really personal, really mean. I think it was a comic actually, really mean comment. And I was in tears about it. Like, and I was like, if my friend would have called me and said this happened, I would have been like, who cares? Like, it's just an idiot. Like, it doesn't matter. But I don't know. I think you have moments as a veterinarian, whether it's like a Google review or like what, and I was like, it just hurt me. It just did. And I think other times I'm like, well, you don't like it. Like, I go to small towns and do this thing called Yuck Yucks on Tour. It's in a community center. There's like skidoos, like people have come on skidoos. Like, if there's a lot of skidoos in the parking lot, like, I'm not going to do well. Like, it's just not. Like, I just know. I kind of walk in and I'm like, oh, this night's going to blow for me. But you just try to like get up there and see if you can make people laugh. So, yeah.
So, like, part of why we do this, go ahead, Bill, and then we'll start with the jokes.
When you, and Greg can share my lead balloons later. How much of your comedy is like, I'm trying to make everybody laugh versus I'm trying to make like my audience laugh?
Yeah, that's such a good question.
Like I like with writing, like I'm like, this is for 300 people in the world, maybe.
Yeah.
Right? Like, is comedy like that? Or are you trying to know? Like, I want every room, like you say, there's skidoos in the parking lot, I'm toast.
Yeah, I'm going through that right now, but I think I'm like, here's the weird thing with comedy, like, I'm just like middling at a Yuck Yucks. Okay, so like, let's not make it. And I was at a fringe, so like, I'm not like, it's not like I've hit the big time, not quitting my day
Right.
job, right? You know, it's just like, it's more than a hobby, but it's not like I'm like, I don't want to give the impression I'm a huge comedian.
You'd make the pro-am. Like you'd represent yourself well.
Yes, that's true. Yes. And I am working towards goals. And every year I'm like, I just got to progress. Like as long as I progress every year, I'm happy. Yeah. So, but I've realized, like, as people progress, you can kind of take either path. I think you will limit yourself if you try to make everyone laugh, but it's easier when you're right where I am, you will do better if you make everyone laugh, if that makes sense. But if you want to do, like, if you want to get further, which, you know, I'm a nerdy vet, of course I want to get further. Like, you know, people are like, what are your goals? I'm like,
winning.
Of winning. Yeah, exactly. Thank you.
Yeah. Sure.
That is like one of my jokes about veterinarians, because when I do comedy, like, my friends are like, that are not vets, will be like, did you have fun? And my vet friends will be like, did you win? And I'm like, it's not a competition.
Did you get an A?
Exactly.
Yeah. I've gotten 100% on comedy.
Yeah.
Exactly. I also try to win at yoga, so it's like the same, you know, like, I'm going to win yoga today. So anyway, I think if you want to, it is, if you want to be like really super successful, which I don't know if I ever will, but of course I do. Yeah, of course I do. You have to focus on your audience, and you have to find your audience, which is really hard when you're at my level, and it's easier. The guys,
in the parking lot,
the skidoo guys, like, they want the dick jokes. They want the, like, kind of potty jokes, or those kind of easier jokes. And I'm not trying to, I sound rude. They don't want the, like, perimenopause jokes, or the, like, whatever, you know, like, they don't want that. And that's not funny to them. And so I'm trying to go through that right now. And I went through it at the Fringe, because I did 8 shows in a row that were like hour-long shows. And there was people there that it was not their cup of tea.
Sure.
Not at all. And then there was women there who came up to me and said, I feel seen. No one talks about this. Thank you for talking about this. I have cancer, you know, because I'm a thyroid cancer survivor. So I also make hilarious jokes about having cancer. And, like, but I had women come up to me and say, I have cancer right now. And that really made me laugh. And but that could go either way too, right? Or so
you could really hurt someone, but
well, that's that's a whole other thing. I'm not going to say that. You could, but some people just didn't, it wasn't their cup of tea. I had other people come and talk to me about what they have ashes in their house, because I was talking about my dad's ashes, and, like, people come and tell you really personal things about yourself, like, or about themselves. Like, if you've made a joke and it connects with them somehow, they come and are like, I have my mother-in-law's ashes on my bookshelf. I don't know what to do with them, you know? And you're like, oh, that's cool, you know? So yeah,
but now I have to help you, right? Like, to continue to win at comedy and medicine.
To win, yes. Yeah. So I think, like, if you look at the really famous comedians, most of them are a certain audience. There's a few, like Jim Gaffigan and Nate Bargatze. They're just funny. Like, they're funny in their bones. They're not dirty. They're just funny, and they're just going to make everyone laugh. But yeah.
So when we were getting this together, Greg asked us to have some jokes ready.
I know.
Yeah, so I don't know, like, I think we can go in the order of the boxes, and just kind of, like, everybody can say maybe one or two. Bill, probably just one. No, I'm kidding.
I think so. I don't know. People might enjoy watching me bomb twice.
I'm thinking that Bill should get multiple rounds at bat here.
If you bump the first one, I'll let you try again, and then bump the second one, and then it'll be great content.
I would like to not go first.
I'll go first. Well, I want to show my shirt real quick. I know Greg likes dinosaurs.
Oh,
I like this.
Let me see.
Yeah, that's good.
Let's see.
Yeah.
Can you read it?
Yep.
As long as you leave it on, we're good.
Yeah, so I wouldn't walk in an exam room with that shirt, though. You know, I don't think I'd take that risk. But I'm gonna start with my joke. Go ahead.
I was gonna say I don't know if I told this last time, but one Halloween I was working, and I was dressed as Fozzie Bear. Like, I made a homemade costume, you know, from the Muppets, like with the hat and the thing, and I was doing the voice, and I was just like having a great time. And then I had to do like 3 euthanasias that day. It was like a GP. It just happened to be a day where I was fucking Fozzie Bear was euthanizing their dog.
There's no way.
It's like
you didn't have
Patch Adams.
Clothes, like,
No.
It's like Patch Adams, but nightmare form.
I'd have referred every one of those.
And I was like, waka waka, here to euthanize.
Oh man, so bad, terrible.
It's funny now.
Well, I'm gonna do my bad joke, so I'll bump first, and then I won't be the first one at least, Bill. Um, so like when anytime I don't know if it happens to you guys, like when you go in an exam room, like if the dogs are not on a leash or they're kind of close to the door, like they really try going out the room. You know, like you go in, you open the door, it's like, hey, how are you? I'm Dr. Gonzalez, and the dog's like, phew, right between your legs, leaving. So I usually I'm like, oh man, yeah, that's all of us right now. The whole staff would like to do that too, buddy. Come on, let's go back in the room. So it's a little bit of a like we all want to get out of here, just like the dog. But I guess it works better when there's
like with the owner,
when
like
it's happening.
trying to leave.
Yeah. Like I'm also trying to leave, buddy. It's all good. So, and then I had a dog that an owner was picking up to put on the table. It's like blue healer, and he farted so hard. It was like, and I was like, it was the first time I was seeing the person, and we looked at each other, and almost like a standoff, like should we laugh? Like, and then we started laughing at the same time. And I was like, buddy, we need to lay off the beans, man. This is really bad here. So anyway, those are my two jokes. If Greg wants to go next, and then Sarah, then Bill, and then Sammy, I think, because we're in that order. Works the best.
Okay.
Yeah,
and then Dave. Sorry, Dave. Yeah. If you have any jokes, I went first, so maybe you can go after Sammy.
Happy to. I have jokes. They're not veterinary jokes, but I'll make them veterinary.
Nice. All right, then you can go after Sammy then, and we'll go right around the room.
Yeah. Do you want me to go?
Yeah.
Right. Okay. So yeah. I have a couple that like just seem to come up a lot and are like kind of reliable if you can get the timing right. But like one of them's like you're seeing a dog, owner's worried about haziness in the eyes. It turns out to be nuclear sclerosis. It's like not a big deal. And so you explain like, hey, this is not affecting their vision. They're not primarily visual animals anyway. Just like, don't let them drive at night, and that's like, that's not like Chris Rock level or anything, but it's like people like 80% of the time you're going to get a genuine laugh and it's going to like increase the rapport. Like people are going to like the experience better, which as a real side tangent, like I think that point about storytelling is so important. Like when we communicate, we're used to doing this just biomedical dump of like, here's the pathophysiology and like, here's the prognosis and all this crap. And like, it just goes over people's heads. But like that story, like when they came in with the worry about their dog's eyes and then they laughed, it's like, boom, that's proof that they're no longer worried about this. This is not a serious threat to them anymore, which is great. And the other one I do is like, it's during euthanasias, which like kind of seems on the surface sort of crazy, but like I mostly do ER. I do sometimes like 5-6 euthanasias a day. And, like one of the things that just seems to be present most of the time is people like putting their own mentality onto the animal and being like, if I knew I was going to die today, it would be horrible. And I would feel like my family's bringing me in to put me down and like, it's awful. And it's just not how animals think at all. And so like, you try to explain that, like, number one, you're doing this for a humane reason. You really are relieving suffering. And like all of the guilt that you're feeling, that's not what the animal thinks. The animal's just here to be happy, just like day to day. They never think about the future in a bad way. Like they're not longing to see Paris, or they're not upset that they're never going to finish their novel or like any of that stuff. And like that too is usually like, that's a release for people. They go, oh my God, it's true. Like I put all this crap onto my animal and they never had it. Like they just want to be let go. And so like, that's a really powerful moment if I can get a laugh there. And I would say like, again, getting the timing right, probably 80 to 90% of the time, people will laugh in that moment. And it's like, boom, we just took this from this horrible experience that was all mental to this like good story about how we're releasing an animal from suffering that just has no conceptualization of its own death. And I think that's amazing in that moment.
It depends on the client too. Sometimes, like,
it does.
I bet you need to like read the person a little bit, just like a little bit of body language and that greeting, that initial greeting, right? Like you kind of measure up the person a little bit.
You totally have to have a sense of it. And it's like, I think as a communication tool, it's all about like thoughtful spontaneity, like recognizing the moment. Like I swear I can almost like see like a thread, like in the room, like a little butterfly floating around. And like, when it comes right into the viewfinder, I'm like, boom, take it. And, you know, the more you practice, the more you're aware, and the more you like, don't try to force it. You just you're just like open to it and you let it happen. You can have it in those moments, but it's like, it's so fun. And it's genuinely powerful to do that in those moments.
For sure.
Right. So I know you guys wanted jokes. I don't know if I have like, I'll be honest, I don't know if I have like jokes that I say in the exam room. I think I'm probably more doing improv if I'm doing anything, which I think is a really
cool.
It's a tangential tool that I think every veterinarian should do improv, but because you're trying to like key into what they're doing. So I was like, when you guys said that, I was like, I don't know if I have like particular jokes, like when I think about it, but I do have like lately, for some reason, I've been saying this because we have all these liver treats at my hospital. I like give them lots of liver treats. They're always hungry when they come in because we tell them to fast the dog for no reason. So like they're always hungry, and then like I can get their dog's attention. So I'll say, oh look, he wants to get paid for this, or I'll say, I'll just make little jokes like that. But I don't think I have like I don't know. The only other thing, like when people cry a lot with me, and probably with ER doctors too, like, and sad things, and like they're embarrassed, and I'm like, oh, don't worry, like we have lots of Kleenex, or like, don't worry, like we go through so much Kleenex here, or something. It's not really a joke. It's just kind of like, this is normal. Like everyone cries, or I'll say, oh, I make everyone cry. Like, this is what I do. Like, so that they're not embarrassed, that they know, like, this is a normal reaction when your dog has cancer, that I see this. it's not embarrassing. It's just to normalize it. So I don't think those are hilarious jokes, but I think they're just ways to like,
but very deft. Like they're very like deft ways of alleviating some of the pressure or tension, or
you must get people laughing just as a release in those moments. Like, oh yeah,
that's a weird thing. And I think I will say sometimes, like, he doesn't know he has cancer, and that's kind of like what you're saying, Greg. Like, I'm like, you look at the dog and they're like, and their owner's like destroyed, and the dog's just like, can I have some liver? Like, they're just so like, it's so. And I think it's kind of like that reminder, like they're not thinking about their survival time. They're thinking about like, is my leg in pain, or is it not in pain? Like, am I breathing okay? Am I not breathing okay? So I think, I don't know that I have like super funny jokes. You made me think of something though, Greg. I talked to someone on my podcast. She's a nurse and she's a comedian, and she does a lot of end of life stuff. And she's researched this, like people on death row who are about to be executed crack jokes.
Yeah.
It's so weird.
So it's almost like a response. It's like a human response to the heaviness and the tension and the heaviness, and like almost like when people laugh when they're real scared. So maybe it's like a little bit of a reaction to like, oh man, this feels so heavy. Boom, here's a joke, like a seizure,
There's even a story about Voltaire like waving off the priests at his deathbed, saying, no, now's not the time to be making enemies.
No, it's very, and I've made this joke. It's not a good joke. It's so dark, but like when you're getting a red animal ready for euthanasia and like people are prepping the catheter and you're like, you don't need to prep the cat, like, you're like, why are you doing that? Right. Yeah. And apparently like death row inmates have made the same joke. If they're getting killed by lethal injection, people are like prepping it. They're like, are you worried it's going to get infected? Like, which is like the same joke
out, getting the bubbles.
Well, that's that's the whole that's the whole playfulness of it. It's like the beauty of humor, I think, is that it just takes away all the mental strife that is unnecessary. Like it's like kind of a Buddhist philosophy.
In an involuntary fashion.
Yeah.
Right?
Yeah.
Like involuntarily. Like you get that laugh you said is a seizure. It's involuntary, right?
Yeah. And you just go, none of this thing that I took so seriously actually doesn't matter. And doesn't that feel nice? Who wants to take things more seriously than you have to? I know.
Yeah. Right. Well, I think Bill, it's your turn then.
I have two really. So I don't remember the jokes that make people laugh, right? Like I don't like. I remember the ones that like bombed. So
good.
So you guys,
that's what we want.
So one of my early in my career, I had clients. They brought their new cat in. They were asking if they could give the cat milk. I said no. Water's better. And they said, well, they wanted alternatives. And they were like, well, can you make cat juice? And I was like, yeah, maybe if you squeezed real hard. You could have
I
heard
thought that
a
was
pin
funny.
drop in that.
I
word.
like that joke.
Yeah,
That's funny.
I thought it was hilarious, and I'm like trying to stifle my own laughter at my own joke, and these people are mortified.
But who asked about cat juice though? What the hell is that? Like I don't know what I think of when somebody says cat juice. Like what
Right,
else?
like that's where
What
my
else could it
brain
be
went.
other
Like,
than squeezing the cat, right?
yeah, that's what I'm saying. Like that was the punchline, and they didn't want to see me after that with their new kitten. And and then a couple of weeks ago, somebody asked me. They were like, "Oh, they got a new dog, and then she's a Cavachon Maltipoo, and do you know what they're prone to?" And like the doctor part of my brain is like running through these things, and my mouth, independently of my brain, says identity crises. And the woman was very offended.
These are good jokes.
Yeah, like these are decent.
These
but
are
like,
good jokes. That's a good joke.
But I remember because they bombed, right? Like the client asked for the records to be transferred before I finished the exam.
No.
But if she laughed, I wouldn't have recalled that joke at all.
That's their own fault.
Yeah, you don't need those clients, Bill. They don't deserve you. They don't deserve you.
It's better that we sort these out early, right? Like,
yeah.
But it's like, wow. But my brain, like the like type A, want to win and get A's.
Yeah.
Like, I don't remember the victories, right? Like, I'll remember. Oh man, that went really poorly.
That's what vets do. That's what we do with our cases too. I think
that's true.
We can have a whole day of victories, and then the one person that was a little bit mad at you is like, oh, that, whatever. But anyway, go ahead,
Bill,
Dr. Sara.
Bill, I think you can rescue your if you bomb, like you can rescue it by just like this is what comedians do, right? You can rescue it by acknowledging. Like that joke didn't go so well.
Right. Yeah,
and start laughing yourself.
I was asking about practice. Like, how do I get up there and bomb?
Yeah, but I think it's all about being vulnerable and in the moment and honest, right? And you were honestly trying to connect, and it didn't work, and then you can just laugh at that because I'm laughing because it's really funny.
Yeah.
Your jokes are funny.
Yeah, it's a compliment. That's a meaningful compliment coming from you. Thank you.
But it's fun. It's also funny that they bombed. That's hilarious.
Yeah, I think that's funnier, right?
Yeah,
Like,
it's actually funnier. So
memory.
like just lean into it, and then some people aren't gonna like you as a vet, and you probably don't want to work with those. Like that's where I'm always like,
that's how
good.
I feel. Yeah,
go somewhere else. Like I don't want to talk to people that don't like me all day. Why would I want to do that? Like
I've told clients like, you don't like me, you don't trust me, you don't laugh at my jokes. Like go somewhere else. Like find somebody you will like.
Yeah. You should do that. Like it's not prison. Like you're not. I'm
not for everybody, and I don't think any vet's for everybody.
I am not. I've had people though that are really rude, and it's not really about joking. I say you need to go to someone else, and then like again, I'm not trying to toot my own horn, but just because I'm a subspecialist, right? And they're like, but you're the best one. I'm like, yeah, but you don't like me, you don't trust me. I'm not cutting half your dog's pelvis off. Like not gonna happen. And I'm like, you're gone. Right. Like bye. Because you need that relationship is based on trust.
Yeah.
I'm just like,
I agree with you completely. Like the informed consent thing is, especially at your level of like the subspecialty, is like
everyone.
Nobody understands. Like you want me to explain 4 years of undergrad, 4 years of vet school, and 11 years of practice in the next 60 seconds in a way that you who don't have a scientific education can understand? Like, or you could trust me.
Or you could trust me. Yeah. Or you can go find someone else that you like.
Yeah. Or you can find someone else that you do trust.
I think as a young vet, like you feel like you have to make everybody your friend, and everybody has to live happy, and everything has to go perfect. And then, like as I'm getting older, I'm more of like, okay, this is not gonna work. See you later. But
I can tell you guys stories. No, I'm just like, bye. Like I'm just
bye. No, I'm done. Yeah. Sammy, you want to talk a little bit about how you use comedy in your work, and like if you have specific jokes too that you want to share?
I have one joke that I use pretty regularly. It's usually like when a cat's coming in for an amputation and people have like all these preconceived notions about what that looks like and the stigma of being an amputee and how horrible the cat's life is going to be. And I'm like, oh, don't worry, cats are born with 3 legs and a spare. Like they don't really need the 4th one anyway.
Perfect.
Yeah, that's a good one.
Like alleviates all the worry, right?
It usually lands pretty well, even if they're like still mortified at the end. I never usually get a reaction that's like mortified.
Yeah.
Right.
I can help you. I talk about practice. Yeah.
All right. I think Dave, you have some jokes you wanted to share.
I'm not a veterinarian, right? I can speak from a client perspective, and then I'll tell you a joke. But I was thinking when Dr. Boston was talking about her her approach, like kind of improv like that. But then I'm also thinking as a client how much I want my veterinary practice to be both confident and bring some levity, right? I like that levity. It's connecting. And so if you're smarter than me, which you are, you don't necessarily need to speak in big terms. You can relate things to me in my level. But then I was thinking about how when I'm nervous, I'm the comedian. And the worst place to be funny, and I try it all the time, is at the phlebotomist when I'm going to give blood. Because I warn them right up front. I'm nervous. I'm going to talk a lot. And then always invariably when that needle's coming near me, I just clam right up and I think this is the wrong time to be funny, right? This person is about to hit me with a needle, right? So I find myself very, very situationally funny then, or I think I'm funny, but it's just out of nervousness. But my joke, right? So I don't know, Dr. Boston, if you ever do surgery on fish, so maybe this is a fish joke you can bring in. I've got two of them. They're both sort of how my humor works. What did the fish say when he swam into the wall?
I got it.
It's go ahead, Bill.
Damn.
And the other joke is similar. What did the one fish say to the other fish when they were in the tank? Hey man, do you know how to drive this thing?
The
I
tank.
like that one.
Nice. I like it. Yes.
So Greg and Sarah,
It's appropriate. It's appropriate
Yeah,
for right
that's
now,
good.
for
Yeah.
sure. It's a
there's
war
probably a term
joke.
for that type of joke where you have to misdirect. Someone has to think about the brick wall or think of the army tank. I don't know what it's called, but I love jokes like that.
Yeah.
Mhm.
Misplaced focus.
Yeah, right.
Yeah.
Right? That
That was a good example. I heard a comedian the other day say that comedy is just like taking one concept and another concept and then putting them together, and then it's up to you to figure it out.
Yeah,
Right.
It's almost like
Like
one person laughs,
that.
one person laughs, everyone else tries to figure out why they're laughing. Right.
Right. Exactly.
Yeah.
So it's up to like really the audience is really who's at fault if it's not funny. But
Yeah.
you know.
isn't it so funny too with like you'll laugh even though you don't get it because you're just trying to fit in, and it's like total fake laughter, and then that's kind of
all the time.
on itself.
All
You're
the time.
Why am I doing this?
And then
And
my
it's-
wife knows. My wife knows when I don't get the joke and I laugh.
Yeah.
For some reason, she detects like when I laugh when I know and when I don't know, and
Yeah.
she always calls me out on it.
There's
Like, why are you laughing? What's funny about it? And it's like, dude, no.
there's two distinct forms. Like there's genuine laughter, and then it's the smile, but it's called the non-Duchenne, Duchenne and non-Duchenne. And the non-Duchenne is like the fake. It's like, and you can tell people are so good at noticing that, and like the better relationship you have, the more you can tell. Like some people are good at faking it. They, actors and actresses, they can kind of appear like that, but it's like it's false, right? That is not the seizure like involuntary thing, and it's a totally different brain pathway too. So this MRI study I was reading, like they said, hey, can you smile, like smile, or laugh, like laughter yoga, right? People just go and they forcibly laugh. But then when you tell them a joke and they laugh involuntarily, totally different brain pathways, right? You don't really get all of the benefits from the fake one, the non-Duchenne laughter. It's just fascinating.
And there's also like laughter is very contagious. So that's like there's a bit of a science to how they see you in a comedy club. And actually, it's why sometimes stand-up doesn't work that well at conferences, which is something I've been thinking a lot about because it's not a comedy club. It needs to be like dark, people packed together. Alcohol helps. Like people need a little something to lift some inhibitions. And like I've done stand-up. Well, the most recent I went to Davis and I was doing stand-up for the student AVMA, and it was lovely. There was a few issues, like the students, they're lovely, right? But they were like, they wanted me to do a keynote. So I wrote a keynote. And then like 5 days before I was going to Davis, my friend at Davis said, oh, I'm coming to your set. And I was like,
nope.
Like, pardon? And then like, so I got in touch with the students. I'm like, are you guys thinking I'm doing stand-up? And they're like, yeah, we want stand-up. And then I was like, oh my God. So I contacted the
stand-up is a heavy lift. That's
for 30 minutes. They wanted 30 minutes of stand-up.
Oh.
And then I called the associate dean. I'm like, okay, like someone's going to get offended. Like, I don't have just like clean vet humor for 30 minutes. Like, I don't do that. I don't like that even. I don't do that. And I was like, he's like, no, it's fine. But he goes, I just don't like when vets or when stand-ups, like if you make fun of the client, I don't like that. I'm like, well, you don't like that. Someone else isn't going to like that I swear or someone, like everyone has their thing. Anyway, it was like this field at Davis. It was like a football field. It was like a stage. It was light.
Oh no.
There was like a beer tent, but it was like beside the stage, but far from the stage. And if you were drinking, you couldn't leave the beer tent. And it was like a picnic. So people were so far from the stage. And I was like, okay, this is everything wrong.
This is hell.
Like,
Yeah, this is
I
terrible.
was like, oh my God. So yeah, I did it for 30 minutes. And I was like, I don't know if I bombed, but it just, I mean, it wasn't. Anyway, I learned that like, if I do true stand up at a veterinary conference, like I'm going to have to control the situation. I'm a lot better than that. Or it's storytelling or it's keynote that's humorous. And that is like,
Wait,
yeah.
Are you going to be at AVMA?
No.
Oh, okay. I was going to say, like, could you come to Greg's workshop?
I would love to.
I got to sign
do
up
that.
for it. Greg,
I
when
would
is
love
your
to.
workshop
Yeah.
scheduled? At AVMA?
It's the Saturday. I don't know.
Okay.
I think it's Saturday. But yeah, it's all this stuff. It's all like I just did this huge deep dive into it, and then like my humor is cartoons, but I think about it like through this whole cognitive appraisal lens, and then cartoons are nice because for like nerdy introverts, you just get to draw on your own paper, and it's like taking a test, and you feel like really comfortable. I mean, stand up is for veterinarians. That's like or even improv. I think improv maybe is even scarier for a lot of veterinarians because it's just like, wait, I have to be playful like in real time. Like I don't get to like read the textbook and study and like do all this stuff.
Yeah.
But it's
in
so
a way that
cartoons,
I've never practiced before. Yeah, that's anxiety.
Yeah. But that's what you're doing when you're talking to clients and to staff members and the colleagues and everything.
Yeah.
But it's interesting.
Somebody brought up the other day about like how sometimes one of our staff members can use comedy and it kind of comes off more as like that person's having problems and they're just cracking jokes because they need help and there's something funny about their jokes and they're, can you talk a little bit about that, Greg? And how have you noticed that? Because you do relief.
Yeah.
So I'm sure you work with a lot of different teams and different cultures and things like that. Like, do you ever run into that? And like, what do you do in that moment?
Yeah. I mean, like, you guys are talking about like your clientele and how, you can use humor as a way to kind of like separate out like, okay, like I want to be myself. And so you like me, you like my humor, or you don't, you can seek somewhere else. But like as relief, like I sort of have to leave everybody happy, like client, staff, owner, like everybody needs to like be satisfied when I leave. Otherwise I'm not really doing my job. So I kind of have this, like, that's sort of why I wanted to break this down scientifically and be like, can I do this reliably? So John, if you're talking about like somebody using self-defeating humor or like
right, like on the floor, right, with the other staff members more, like I think a lot of people that watch this type of what we're doing is people that are looking for like practical things, and I it's one thing that has come up where you notice like the staff member, this coworker is kind of like something's wrong and they're joking about that self-deprecation and all that, right? How do you manage that? Like, how can we manage that at work?
Yeah, I always think about it like dissect the humor. It's easy. It's very easy to tell usually when somebody's trying to make a joke. Even if it doesn't land, like you can tell they were trying to take something not seriously, and so then you just dissect that. Like, what was the target of the joke? And if the target is like themselves and how they're a piece of shit or something, you're like, okay, this person is having some self-confidence issues, possibly. It depends on how it lands, and it depends, like you really do have to dissect it, which is, and I think that most comedians will tell you not to. It's like they tell you not to do that. That you just let it go. But I think you can like break it down and think about it. So if they're saying that, or there's it's called dispositional humor, where you're like making fun of an out group. Right. So for me in like a relief setting, like I can't do that. Everybody has to be included in the joke, but you can joke about somebody else, right? Like that's bullying, that's aggressive humor, that's towards somebody else. So just thinking about like, what was the target of the joke? And you don't have to tell a perfect joke at every single situation, but just the more that you recognize, like, okay, this person they may be deflecting with humor. We were talking about that, right? Like, Dave, you were talking about, like, you're nervous, right? So you start telling jokes, and what you're doing is you're telling your brain, like, hey, don't take this so seriously, like, try to deflect it, right? But as you get more and more wound up, like, sometimes you can try to be forcing things in, and it can be counterproductive. Like, humor is just a tool, like it's like a scalpel. You know, if you put the scalpel in the wrong place, you know, it's going to cause problems. But if you put it in the right place and you do it well and you handle it well, like, it does amazing work. So I think about that. Like, I think about more like when I'm seeing somebody tell a joke. Just really quickly, I had a client 2 days ago. She's got a 160-pound Mastiff that is down in the back end, and it's like 5 years old. It's eating, it's happy otherwise, but it's having this pelvic limb weakness. And I'm trying to explain, like, this is a crazy serious problem. Like if this animal can't move around, if it can't go to the bathroom, like, euthanasia is not that unreasonable at this point. And she's sort of laughing because, like, it's this big dopey Mastiff who's sweet, and, like, you know, she's laughing because she's like, oh, this is kind of humorous. And I'm not, like, I'm dead serious. I'm not using that moment to laugh, because I'm like, no, this is not a playful thing. Like, we cannot be, like, you're deflecting, or you're avoiding this reality, but, like, it's my job to actually bring you to the reality appropriately. So, like, that's a moment where, like, you know, 90% of the time I'm like, let's get more humor. But if a client is laughing about something that I know is actually serious, then it's my job to kind of, like, hold them, like, say, hey, like, I get it, but actually we do need to talk about this. And, like, I don't want to ruin the fun, but, like, this is not a thing that we can have too much fun with. Like, this is more serious than you realize. So it's just like knowing, you know, and the more you pay attention to it, I think the more you can kind of recognize it in these situations. Like, am I using humor here to make my job, like, to make the whole situation better, like, for the animal ultimately, or am I using it to deal with my own stress, or to, like, deflect some important thing? And that's where it's like, it's not just like a pure good. It really is a tool, I think.
Yeah.
Yeah.
You just made me think I'm sorry.
No. We're coming down to the last few minutes, and I'll let you finish your thought there for a second. And then after you finish your thought,
Okay.
I wanted to see if you could talk a little bit how, like, normally you would think medicine, no matter what type of medicine and comedy, would collide, but they come together pretty cool, you know. And I wanted you to, like, finish your thought and then maybe talk about how medicine and comedy kind of come together.
Okay, I will. And we never heard Chris's joke, so we need to do that. But I just really quickly, Greg, it just made me think of something like, you know, as much as I love humor and humor in the workplace, I really hate pranks. I really hate them. And I think I've had some issues. Like, one of the places I worked, people did a lot of pranking on each other. And it's weird because I think I have this great sense of humor, but I think in my head, I'm like, that could hurt someone. Like, people jumping out of boxes to scare the hell out of people. I was like, someone could get hurt. It was people jumping
throwing testicles to each other.
Yeah,
you know, like, they stick. I don't like that.
Well, any of those pranks, I think that falls into, in my opinion, again, like, people may disagree, but I think those pranks, they just have the potential to hurt someone, to feel left out, someone to feel singled out, someone to have their feelings hurt, or just not think it's funny. And then when they don't, people are like, well, you don't have a good sense of humor, which was actually me.
Yeah, you're now an outsider.
You're an outsider from this hilarious pranking that's going on. And anyway, I know we're running out of time. I'm not going to talk about it more. I'm just going to say, like, Dr. Boston does not like pranks. That's it.
Well, Chris, go ahead and tell your joke.
Yes, Chris,
I'm really curious. And then after that, I just want to hear Dr. Sara talk about, you know, how medicine and comedy come together in general. That's a thought that I thought I'd like to hear her talk about.
So I don't have a joke to say or to tell or to share, but I do have an experience from the client perspective coming in. And it kind of relates to what John said and the dog running out of the room. So my dog's very well trained. And when I go into the vet, it's very easy for me to get my dog to hop up on the table, lay on the ground, do whatever it is, and she'll stay there for the most part. So I often, as that introduction, the veterinarian or the vet tech is usually like, oh, can you come in and train all the other animals? We want to hire you. to come in and just make sure that everyone's trained.
Good one.
And so it's just like an ease into the
Good people.
relationship and the discussion. Yeah. So it's nice, it's warm, it's welcoming. And then another time at a different vet, they're like, we've got a bunch of cats here. Can you come and herd them or train them? So similar, same thing, right? Just kind of like, hey, we'll do the introduction. We'll have a short little like joke or entry through comedy as opposed to just like sterile and serious. And so it's nice and it's warm, it's welcoming.
Yeah, sure. So, yeah, Dr. Sara, how can comedy and medicine come together?
How
Like,
do they?
I think people wouldn't think that would be a good mix, but it is.
Yeah, I kind of think of it as like a Venn diagram again because I'm a nerd. But I would agree with Greg. It doesn't always come together. Like if you're doing something serious, you have to be like serious in that moment. But I think for me, like a lot of medicine is creativity and like comedy, writing, cartooning that Greg does, writing that Bill does. Like there's an element of creativity and using a different part of your brain and kind of firing up a different part of your brain. And so I think for me anyway, that's where it comes in because there's just a lot of creativity, I think, in surgery and in medicine. And if you're kind of like using that muscle of like being creative in a different way, I think when you bring it into medicine, it's there for you. It's kind of working for you, even if you don't even realize it. It's kind of working in the background. So that's one big way. And then I think for me, it's also just like trying to not take it so seriously. Like I love what I do. I think it's important. We're dog doctors. Like, let's, take it down a notch, everybody. Like it's fabulous what we do, but it's like, we're not in the pit here. Like, let's,
Yeah, that's true.
so I think for me, like just
Absolutely.
take it seriously, but not so
You can take
seriously.
the work seriously without taking yourself seriously.
Yeah, that's a good way to put it, Bill. Yeah.
Any final thoughts or questions for Greg or Sara at all?
I just
Anybody?
want to say Sarah's.
Yeah.
If you have not listened to Sarah's podcast, she's done how many episodes now? Like
we're in season 6, so like it's like 50.
Wow.
Like, yeah.
Like
Cool.
and it's all about just people that do like humor and medicine in like every different permutation of that. It's amazing, and like the people that have that do take it seriously, like take medicine seriously. Obviously, like everyone's done training and all that, and then comedy seriously too. So it's like this fascinating exploration of that exact subject. So like I think Sara probably knows more than anybody, I swear, like more than anybody in the world about the experience of people in healthcare and comedy. And it's like it's every episode I'm like blown away. I'm like, wow, like it's so great. It's really awesome. Thank you.
Well, Greg was a guest, so listen to that one first because he was an amazing guest.
I did. I
Okay.
did listen to that one. It was pretty funny.
It's honestly one of my favorites. And
Yeah,
I got to Greg, so that was good. Yeah.
Yeah, my favorite part was the part when there's a doctor that's not practicing, and then Greg was like, he's not a doctor, and you're like, well, he kind of is a doctor, right? And Greg's like, no, he's not a doctor. I'm like, oh my god, what happened here? And then you start laughing at the end of it, and that's so funny because I think I would love to ask him that question, and that would really solve the mystery. Like, hey, Dr. Ken, are you still a doctor? Because I myself don't know the answer there. Like, who knows? Like,
Yeah.
it's however he feels, right?
Yeah.
But yeah, listen to the podcast called Co-Medicine. Greg was a guest on it. You should probably start with that one.
Yes.
And then listen the whole 6 seasons. And I don't want to take much more of your time. We're a little bit over the hour, so I appreciate everybody showing up today. And you're welcome. Thank you so much for coming. And Greg for inviting you. I really
Thanks,
appreciate
Greg.
that. And I think I almost thought of doing just comedy, making FlareVet about just comedy. I think there's so much we can touch base on. I think we should do more comedy stuff. Maybe a whole spin-off on comedy with Greg. We'll see.
Yeah.
Cool.
It's
Love it.
I also like just it really enriches our culture, like as veterinarians. I think it's like Co-Medicine podcast. There's a lot of veterinarians on there. Like just having, like, we have a culture, like we have writers, we have musicians, we have comedians, like it's so great to have that. And even like Sarah's show, I watched your last year's Fringe show, and like veterinary medicine is a big part of it. You know, it's like this whole like core of it. So it's, I don't know, it's great. I think everybody that's putting stuff out there is to be commended and encouraged.
Thanks for watching it, Greg. Maybe I'll, if you're up for it, I want people to watch my latest and give me feedback.
Oh yeah.
I might
is it uploaded?
It's not in the world yet, but I'll yeah.
We'll be careful with the feedback too. You know,
tag us when you post it. I want to see it.
Too rough, you know. Yeah. It'll be good feedback.
Yeah, it's okay. It's okay.
Thanks again, everybody. Okay. I will see you probably next month in the next session here, and this is gonna be recorded later if you want to share it with everybody, and you know there'll be websites and things you can visit with their content. So thanks again, and we'll see you next month.
Okay.
All right. Thank you. Bye bye.